Hi, I'm Hunter.
Hunter has asthma. Like others who suffer from asthma, Hunter often finds himself coughing a lot. Coughing is a voluntary or involuntary protective action that allows for the removal of unwanted substances. Coughing is not only present for those with asthma, but also with viral or bacterial infections, lung fibrosis, COPD, bronchiectasis, and even non-respiratory diseases. Observational and clinical trial data have shown that on average, chronic cough patients are coughing about 20 to 30 coughs per hour for several years. Hunter went to see his physician about his continuous coughing, yet she was only able to show him a finite number of solutions. These existing cough monitoring devices were limited because each cough had to be manually marked by a trained individual, and it sometimes would take weeks before getting a cough report. Introducing Cough Helper, a fully automated cough detection system. Cough Helper can record audio and then filter speech and cough-like sounds so that physicians can get a handle on your cough patterns. Now we'll demonstrate how Cough Helper works.
A really fun ride. It's a Tony Scott movie, without a doubt. And I think also what's great about the video is it's an honor that defies words.
So what did you learn from Denzel?
Comfort from
As you can see, we were able to detect 4 coughs and also summarize their characteristics in a table. We can also view the spectrogram, power spectral density, and total power plots. Here's a closer look at how the software algorithm works. An audio file is inputted into the algorithm. For this example, we will be using this 22-second clip that contains speech and coughs. The first stage of the algorithm is to isolate sound events, which are smaller sound clips which we will be analyzing individually. We select our sound events by looking at the standard deviation of the values. So if there is a lot of variation in the audio signal, we know some sort of sound is being produced and we want to save that part. Here, we can see the highlighted sound events that have been picked up by the first stage. Anything that is not highlighted is discarded. The next stage of the algorithm is speech filtering. This is an important part of the algorithm because we want to ensure that we are discarding all speech before the data is sent anywhere for confidentiality reasons. In this stage, each sound event is analyzed individually and labeled as either a cough-like sound or a speech sound. A cough-like sound will be anything that could sound like a cough, such as a throat clear, a sneeze, a laugh, and of course, a cough. Here, we can see all of the highlighted sound events are ones that the algorithm has determined is a cough-like sound. Any sound event that is labeled as a speech sound is then discarded. Now we are on the last stage of the algorithm, where we will use a more specified algorithm to pick out the coughs from all of the cough-like sounds. Similarly to stage 2, each of these sound events are analyzed individually, and each one is labeled as either a cough or a non-cough. Here, we can see that the sound events labeled with cough are highlighted, and the rest of the sound events are discarded. Now that we have our coughs, we will output this data along with some other important information, such as a timestamp of each cough, as well as parameters such as frequency, intensity, and duration. An Arduino Nano microcontroller interfaces with a number of components on the breadboard. An accelerometer measures acceleration in the X, Y, and Z directions. When the acceleration exceeds a threshold, an electric microphone amplifier begins recording audio. The recorded audio is then saved as a WAV file to a micro SD card. An LED will also turn on to indicate to the patient that their audio is being recorded. And a patient can stop data collection by simply pressing a button. The device is powered by a battery and is small enough to be worn on the patient's chest. One, two, three, cough, cough, cough.
1, 2, 3, cough, cough, cough.
Hunter's physician can now gain more insight into his coughing and formulate a treatment plan. Hunter is one lucky guy.